Good evening and welcome to the Henry Schein Dental Academy webinar series. My name is Corinne and I will be your moderator this evening. We are excited to welcome Dr. Marc Geissberger, leading clinician and renowned educator, for a deep dive into electric handpieces and matching the right settings, speed, and operation to the case at hand. Before we get started, we do have a few reminders for you. At any point during the webinar, if you have questions, please type them into the Q&A section of your control panel, and we will answer them live at the end. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand, and this webinar is sponsored by NSK. Dr. Geissberger, welcome, and thank you for being with us tonight.
Thanks, Corinne, for having me. I'm just thrilled to be here. Welcome to everybody, and let's go ahead and get started. So I'd like to first talk just a bit about myself so you know who I am and where I come from. I graduated from dental school in 1991, and I returned to the faculty immediately after graduation and spent 27 years teaching undergraduate dental students while maintaining a private practice. I retired from that in 2018 and now just do clinical practice and educating dentists. My practice is here in Marin County, where I practiced with my father and my brother for 30 years. I do a lot of proctor evaluation, help companies bring products to market, give them ideas on new technologies and how to direct them towards success with new products. And I'm also a member of a group called Catapult Education out of Chicago, Illinois, founded by renowned speaker Lou Graham. We're a group of like-minded lecturers who go around teaching others how to do dentistry in what we think is a better way or fashion. I've published a book called Aesthetic Dentistry and Clinical Practice, and I'm on Facebook at Marc Geissberger DDS or Instagram at Marin Dentist. I put my email here. If you've got questions following the program tonight and you want to email me, feel free to do so. Well, with that said, we're going to speak a bit about handpieces tonight, and I need to disclose to you that Henry Schein Dental and NSK have asked me to present this. Now, I have a rule when I present on things and I receive an honorarium, and that rule is simple. If I don't use it, I won't present on it. So you need to know that sitting here in my practice, I've got NSK handpieces, both air-driven and electric handpieces that I've had for years and have worked with very successfully. So I'll talk to you about some of the benefits of going electric this evening. Now, with that said, I want you to also know that as Catapult, a member of Catapult, we work with a lot of companies. The ones here in black are Catapult in general. The ones in blue are companies that I have a personal relationship with, many of the known companies in dentistry. And the one in green is the sponsor for tonight's program. So I want to thank NSK for their generosity in providing Henry Schein with help towards my honorarium this evening. So today's session really is going to cover the correct techniques for cutting off zirconia, lithium disilicate, or PFM crowns. What should you do? How should you do it? What burr should you use? What settings should you use? Then how to create really beautiful, refined margins with correct handpiece settings. And then finally, what the appropriate settings for caries removal is. How do you do that without potentially damaging the pulp? And really that's based largely on what handpiece you're using and what burr you might select. So we're going to cover a bunch of stuff. I'm going to show you a bunch of clinical cases that really highlight different techniques that I found very successful. And we're going to start first with a discussion of electrics versus conventional handpieces. Now, with that said, electric handpieces were really developed several decades ago and have been in regular use in Europe. In fact, about 80% of general dentists in Europe and in Asia use electric handpieces. Now that's contrasted with the United States. In fact, that the vast majority of practitioners here in the United States actually use an air-driven handpiece. So there's quite a contrast between Europe, Asia, and the United States. Now, NSK has a long history of producing top quality handpieces in both the air-driven mode and the electric mode. Now, what I've got pictured here is my NLZ motor. my NSK Z900 standard handpiece, air-driven turbine, and my Z95L electric handpiece, high-speed handpiece, as well as my laboratory motor. So I've got a lot of NSK equipment here. I've had it for years, which I really appreciate is what low maintenance and high quality it is. And we're going to talk a little bit about some of the subtle differences with their product. Now, I want to contrast electric handpieces to air-driven handpieces. First of all, electric handpieces actually move at a lower speed than, say, an air-driven handpiece. Now that's interesting because they're actually a more efficient cutter. Well, how do they do that? Two reasons. One is they maintain torque without burr slowing. And that's interesting. When you take an air-driven handpiece, what happens is as you lean on that, you can actually slow the burr down. And really you get better concentricity with electric handpieces. As your air turbine handpiece moves, there's a lot of movement within the burr head, and you can actually lose the concentricity of the handpiece. So, you know, there's a lot of research that's been done on electric handpieces and comparing and contrasting these, but with suffice it to say that although electrics may be a little more expensive to get into initially because of the motor cost, in the long run, what I found is you actually have far less repairs and replacements with electric versus conventional. So with the electric handpiece, one of the issues initially, and this has been a big issue for a lot of people, was two things. First of all, their weight, and second of all, the ergonomics. So they were actually initially quite large and bulky and quite heavy. Well, when you look at what's happened with NSK, they've been able to manufacture on these in such a way that the handpiece is greatly decreased in weight and size. So the fulcrum point in your hand is quite different. Now, one of the things about an electric handpiece that differs from an air handpiece is what we call torque, the amount of torque generated by the electric engine. And I could probably equate this to something like a Tesla. A Tesla operates at very high torque. In fact, the way it's so efficient is by generating a lot of torque when it's accelerated. And that's very similar to an electric handpiece, an electric car. An air-driven handpiece needs air, and that air can be stunted by leaning on the burr. So you've probably noticed that when you're really trying to cut through something as hard as, say, ceramics or zirconia, and you're using an air-driven motor, there's a lot of stall out that occurs from that process. Once you move to an electric handpiece, you're going to notice that that really changes. In fact, removing restorations with electric handpiece, whether it be amalgam, whether it be an old PFM, zirconia crown, or lithium disilicate like an Emacs, is quite effortless. And that's what I love most about electric handpieces. Now, I want to really compare and contrast some of the leading manufacturers. And with this said, Cavo, Dentsply, and Veneers all make fine handpieces. But what I want you to notice is the relative size of the base of these handpieces. And what you can appreciate by comparing these to size is that NSK's is actually the smallest on the market. Not only that, the NLZ control pad fits beautifully into the operatory. They've engineered it in such a way that it's not only the lightest and shortest handpiece on the market, but the control system is so small that it can be really placed anywhere in the operatory. And I'll show you some examples of that. The motor itself can be hidden in several locations in the operatory, depending on what delivery style you're utilizing, whether it's a rear delivery or front delivery, but it makes it a really, really nice setup. Now, this decrease in weight really is beneficial for those of you with smaller hands or those of you prepping for long periods of time. Say you tend to do a lot of full mouth reconstructions or multiple crowns at once. You can actually develop a lot of hand fatigue from a heavy instrument. And by getting the weight down to 57 grams, that really diminishes the problems. In fact, when we first looked at electric handpieces at Pacific, we made the determination to not go there. Now, this is decades ago, but the reason was they were so cumbersome. The handpieces themselves were so large and heavy that those with smaller hands really couldn't manage them. And even those of us with larger hands struggled with the weight for long periods of time. So it's important to recognize that the hand pieces are different. Now here is a comparison of a Cavo handpiece, which is really probably the closest competitor in size to the NSK. But there's a couple of subtle differences. First of all, most of the handpieces, whether they be Midwest or Cavo, deliver lower torque than NSK's NLZ. Now, the reason you really look at an electric handpiece is for the torque. And that's important to recognize that the NLZ motor delivers that 40% more torque than any other competitor. And it does that through a handpiece that's virtually smaller than all other handpieces in the market. Now, that makes it a very impressive electric handpiece. And it's one that I've had great success with in clinical practice for years. So I want to talk a little bit about the different attachments and handpiece attachments. And we'll really focus on the two handpieces I use a lot in practice. The first of all is the high-speed handpiece, the Z95L. And the second is the Z25L, which is basically your low speed. These are the workhorses and bread and butter handpieces in my practice. I personally don't own the Z45L because I don't do a lot of surgery, nor do I do endo, so I don't have the NLZ endo. But I'm a really knowledgeable person as far as the Z25 and the Z95, which are exceptional handpieces. What's different about these is the gear ratio. The high speed has a 1:5 and that low speed has a 1:1. Now, one of the benefits that I mentioned earlier is where you position the keypad, and where you put that is really up to you in your practice. But I like to have it right by my access to the handpiece. So generally speaking, because I use front delivery, that's right in front of me. I can change my settings and go through the procedure at a touch of a finger. It makes it very, very easy. So one thing that's really interesting is DCI Edge has really worked with NSK to incorporate this seamlessly into their chair models. It's really a neat option for those of you who are looking at new potential chairs and marrying those with electric handpieces. So one thing I want to point out, and very few practitioners actually know this, but in the time of COVID, it's important to recognize that an aerosol that we create while drilling is potentially virulent, and we want to diminish it as much as we can. One of the best things about the NSK handpiece is this switch technology, which allows you with the touch of a finger to change from what's called a water spray, which creates an aerosol with a lot of air added to it, to a water jet. That water jet will greatly diminish the amount of aerosol you create while still providing the operatory condition with a lot of water, which makes this really good if you're at all concerned with the aerosol. And I think we all should be concerned with. So with just a simple little tool that'll come in the box of the handpiece, you can switch between the water jet, where it's really water only, or the water spray. Now, sometimes you may want that water spray, say you're in a posterior situation where it's hard for you to keep rinsing. But in the anterior teeth, I set this on the water jet and do just fine. and really decrease the aerosol plume that's created chairside. So it's a simple little switch. You take the little key and you dial it one way to the water spray and one way to the water jet. So this is a great benefit to have that little tool just right next to you, the little wrench that comes with that. There's a swivel valve, and that's just opposite the handpiece there, and you go ahead and do that. Now, I'll get more into some of the settings that I recommend, but I want to talk briefly about Bur Selection. And this is important. Now, one of the things that I like to use quite a bit is a disposable burr. What I found in years of observation clinically was that when I was reusing burrs and constantly autoclaving burrs and marrying those with an air turbine handpiece, we would be sending back handpieces for repair for turbine replacement on a regular basis. And the reason being is as that burr lost its ability to cut, I, as the clinician, would have to lean harder on the handpiece and create a lot of force on the turbine that would eventually wear that turbine down. And sometimes that would happen very quickly. Well, with that said, what I've noticed since I've gone to, say, a microcopy disposable burr is that I always have a sharp burr. And because of that, I have a lot less issues with handpieces, whether they be air turbine, which I still use on occasion, or electric. What that means is these really sharp burrs cut efficiently, and they don't stress the handpieces and cause breakdown as routinely as they did with, say, reusing burrs. Now, I use a lot of 330s. I use a lot of carbide finishing burrs. These happen to be the Neo Burr from Microcopy, which are available through Schein, and they pair beautifully with my my 95 handpiece. Now, these are just a couple of numbers. They use a little different numbering system for their burrs than you'd find, say, with a Brass or other companies. One of my favorite occlusal burrs is the H274. And one of my favorite finishing burrs for a class 5 is the EF9. 9 just refers to the height of the cutting surface. So this here is a 9mm burr from here to here. This is one that is, let's say, a 4mm cutting burr, and it really defines the height. The EF is extra fine, of course, and that's how we differentiate those burrs. As far as diamond burrs, there are lots of options, and I tend to use a fairly coarse burr for most things. Now, I've heard that cutting off a zirconia crown is easier with a finer diamond, and I have experimented with that to some degree and really didn't notice much clinical difference myself. So I'll tend to go with the coarser burrs. What I generally use for crown and bridge procedures is the 1116-8 coarse and the 1923C coarse football shaped diamond. This 1509-3 is a medium grit diamond that I'll use for procedures that I'll show you shortly, and I'll marry those with certain handpiece settings to optimize their performance and result on the tooth. Let's talk a little bit about caries removal. Now, the first thing I want you to recognize is you're going to switch to your slow speed electric handpiece, the 25, not the 95. And you're going to basically determine what type of burr you use to remove caries. And your options to do this are really 3. 1, you could use a conventional carbide burr. In my case, if I did that, I'd use a larger carbide and pair that with my slow speed. You could use a ceramic burr, or you could use, say, something like a Smart Burr 2 from SS White. This is actually a polymer burr, and that's designed to prevent you from accidentally or iatrogenically cutting through dentin into the pulp. But what's essential with these burrs is that you marry these burrs with the correct handpiece setting. Now, Keep in mind when we use an air-driven handpiece, there is no setting of the speed at which the burr cuts. That is set by your foot. The harder you push, the more RPMs. The lighter you push, the less RPMs. The problem there is it's very hard to control. So when you're doing caries removal with an air-driven handpiece through, say, a slow speed attachment, you can actually go too fast with a sharp carbide burr and remove dentin structure that shouldn't have been removed. But when you pair one of these caries removing burrs with our handpiece set at the right RPMs, you won't do iatrogenic damage to the tooth. You'll be very conservative. And Strassler showed that in his study looking at the use of these different burrs, and he was really looking at the polymer burr for caries removal. Now, this is really important. You're going to pair these burrs for caries removal with a Z25L. And these are my recommended speeds that you really range between 1,500 and 4,000 RPMs. For a carbide burr, because these tend to be the sharpest of the three, you're going to keep those RPMs fairly low. If you get these up too high, again, you're going to start cutting unnecessary dentin. With the ceramic burr, if you use those, you'd set those anywhere from 2,500 to 4,000 at a max. And for the polymer burr, you want to keep these at a lower RPMs of 2,500 to 3,000. And they'll effectively remove decay, and you won't run the risk of an iatrogenic exposure of the pulp, which can happen with a sharp burr and the wrong speed. So what's really great about electrics and caries removal is you can precisely determine the rate, the limiting rate at which that burr spins, and really be conservative in your approach to treating those teeth. With that said, I want to talk about some specific restorations, and I'll go through these fairly quickly. We're going to start with direct restorations, class 1 restorations. I'll do some class 2 advice for you, and we'll roll into class 5s. From there, we're going to talk a bit about indirect restorations, my recommendations for speed settings on those. Now, to start, I want to talk about this new concept in treating disease. When we look at a couple of teeth like these, it's important to recognize that whether or not there's caries there, we want to treat them in such a way that we're preventing disease or minimalizing the disease. So in a case like this, we have to really gauge our treatment based on the disease or possibility of the disease, whether the treatment be preventative, surgical, or chemical. When I look at these teeth, I know using diagnostic tools like Diagnodent and other things like that, that I'll have to intervene in some surgical mechanism. For sealants, I'll use a quarter round burr at 200,000 RPMs in a high speed. And I'll explore those grooves using 1 or 2 techniques. Now, I want you to take a look at this lower first molar, and I'll ask you the question, where's the restoration? Well, it's a bit of a tricky question because this restoration was actually done by me. And of course, there's a sealant in the tooth. But really, what's in this tooth is actually a large composite. So I accomplished this restoration using 2 handpieces, 2 settings. First of all, the Z95 at 200,000 RPMs and the Z25 with a carbide burr set at 1,500 RPMs. Now, when I ask you where the restoration is, what you don't realize, it's actually right there. So this was actually a large restoration. When I look at the tooth behind, I can see clearly the outline of the composite, and I consider that kind of an average composite or an uninspired composite. What I really like to do is create a restoration that is seamless. Now, when we open these up, we have to go a little bit further right here in this distal portion, and a little further right here. This was excavated initially with a 330 burr set at that 200,000 RPMs. As soon as I access the decay, I begin to remove that precisely with that slow speed setting at 1500 RPMs. And that's really important that we do that. Now that restoration outline fooled you, and I'm going to get into details on this. So what I did is, after I removed the remaining stain and caries here, we sealed up this occlusal portion and restored that central pit with this conventional composite restoration. We hide these by beveling the cavo surface, and that's really important when you're doing that. So the restoration is somewhere in that proximity. Now, what I like to do with these restorations is use an isolite or some sectional matrix evacuation system. Take a look at this tooth. This is a sealant gone bad. We can see this staining underneath, and it's all probable that this is decay. When we get this well isolated and we start opening this up, we recognize that that sealant initially wasn't cleaned out well enough. So I've accessed this with the Z95 set at 200,000 RPMs, dropped into there and exposed the caries. Then I switch to a slow speed set at 1500 and a round burr and begin to excavate that. I do like using a caries indicating dye. It really helps me diagnose where that decay is. And we can see now there's involvement in other areas of the tooth. This is stemming right off of there. This is caries I've got to explore here. And you can actually see the shadowing up under here of the decay. This is all decay here. And because this is getting deeper, we want to really keep a close eye on that. We get the decay out, we can restain it. We'll come in here and open this up. And now we've got our outline. I'll then come in and bevel this cavo surface with a diamond burr, and I'll show you which one I use for that. This is actually using 3M's ClinPro sealant, which is actually pink. When you place that, I like to place and seal those grooves first. Then we come in there and restore that with composite restoration in the central. And I've beveled this out to our margin. This anatomy is placed simply with an Explorer quite easily, and that tooth is good to go. We check occlusion, and we've got our final restoration. Now, let's talk a little bit about some of the disease-guided preparations. And what I mean by that is you want to pick a burr that really marries itself to the disease. One of the burrs I like for a number of things from microcopy is this medium grit 1509.3. And when you look at this little type it on where we've done some restorations, the central fossa was prepared using a round and pear-shaped diamond burr. This happens to be the 0508 medium grit. And these burrs, these fissurotomies, were created with this 1509.3. All of this done with the Z95 set at 200,000 RPMs. And I'll use this same 1509 to come in and bevel my cavo surface. And there's been lots of studies that looked at beveled cavo surfaces showing your restorations working out better. Now, I'll show you real quickly a class 1 protocol where we're using these same techniques. I got an amalgam here. Whenever you see these blue areas around an amalgam, you know it's leaking. That's it illuminated. We come in here and we remove this. This is all taken out with an electric handpiece very quickly. Why? Because of that high torque. You should have this restoration out within about 30 seconds, no fooling. Then we switch our handpiece to a low speed, the Z25L set at that 1500. Take our Carbide burr, or if you're using the polymer burr, set it at 25 to 3000, and remove your caries. Now, what I like to do is come back in here with the 1509 and explore these little grooves here, get this here, and get my bevel around the cavo surface, all at 200,000 RPMs. We go ahead and etch after we've done that bevel, and we place the initial material. Now you can see where I've got this clear cavo surface. We've got a little flowable composite in here, and we go ahead and restore this. Now, when you look at this, you notice that I've maintained a mesial pit, a central pit, and a distal pit with a corresponding oblique ridge. All of this anatomy is done very simply with an explorer. And I've maintained the integrity of the tooth, and I've made this tooth look like a first molar. And I don't do that with a lot of burr activity. I do that rather sculpting it with my spatula. I love the REJ number 10 from Clinician's Choice, and an explorer to place and establish my anatomy. And we can maintain that. Now, let's talk a little bit about class 2s. First of all, when I was taught in class 2, it always had some form of a dovetail. And that dovetail was actually quite large. The reason it was so large was to accept a burr, accept a condenser, meaning we had to be able to get a condenser head to get in the hole to plug that amalgam. Well, with that said, we can be far more conservative with class 2s. And again, the disease guides the preparation. What I mean by that is the size of the preparation is not a standard preparation, but rather guided by the disease. Now, here is a clinical case where you see the caries, and the size of these preparations are dictated by this, by the size of the caries. With that said, you'll notice there's no central groove involvement. So these can simply maintain as box form only. Now, this is not my case. This is a case I pulled from a textbook, but I want you to notice that there's a little iatrogenic damage here. And you notice right here, this curvature. That's because this clinician was being so careful not to damage the adjacent tooth, but inevitably they did anyway. And that's where I use something like an interguard to protect adjacent teeth. What this does is allow me with my electric handpiece to bump up against here, damage the interguard as I create these conservative boxes without damaging the tooth. And that's something I use on a routine basis with all class 2 restorations. Now, when we look at this preparation, this is a very conservative involvement, and this is just a classic example of where we can be conservative. And we only enter this area of the tooth with, say, a 330 carbide set at 200,000 RPMs if we need it. And we want to protect the adjacent teeth by using some form of either an interguard from Ultradent or a wedge guard from Triodent, one of those type of products. So I want to touch briefly on class 5s. And I really love doing class 5s, but I incorporate what's called an irregular bevel. And that bevel looks a bit like this. It's staggered all over the tooth as opposed to a standard 0.5 millimeter bevel. It varies in both depth and length. And the standard bevel would look something like that. We were all taught that. The irregular bevel looks like a kind of spasmodic EKG. And this will really help you in making your composites disappear. So I want to show you a clinical case. Now, because these are abfractions, I want you to notice that I've actually slowed my handpiece down to around 100,000 RPMs. And to do these erratic bevels, I actually really like that 1509. This is the same burr I do a fissurotomy with. And I can come in here and create these irregular bevels at half the speed I normally prep at. That allows me to be a little more precise in doing this and a little more guided in that effort. The more irregular you can make these, the better off you are in the long run. So I've got a cord in place here, and I'm ready to restore this. And I'll use either a self-etch or selective etch technique. I'll demonstrate using Kerr's OptiBond Extra, that technique. So here are the abfractions. I place my cord, I place my irregular bevels. Now what I'm going to do is go ahead and etch the enamel only. Then I use the primer, step 1, to selectively etch the dentin on both teeth. Then I'll selectively etch and place the adhesive. And then for these, I like to use a flowable composite as my restorative product. Now, when we get done with this, we're going to slightly overfill with the flowable. We're going to cut these back. My advice is you're going to use the Z95 at 200,000 RPMs with a carbide burr to finish the area on the occlusal. But my suggestion in the cervical area is you cut your speed down to 100,000. And that's almost like doing this at, say, a stall out speed with an air driven. But what you'll find is you'll get a lot more tactile feedback around the gingival area because we really don't want to cut the cementum. And I'm going to use a carbide to do that. A lot of you are tempted to use a diamond. I wouldn't. And the reason I wouldn't is a diamond tends to scratch that cervical area quite a bit. So we come in with a carbide, we finish that back, then we polish, and these will be seamless restorations. Well, with that said, I want to quickly move into some comments on direct restorations and where to set those hand pieces using a direct or indirect restorations. Generally speaking, to remove old PFMs, I know there's several burrs that you can cut through everything, but I actually like to switch it up. I'll start with my round and tapered burr, and then I'll go to the Emacs cutter. A Max 1 looks a little shorter than this one. This happens to be a Max 2. It's a little longer. But with PFMs, it's really important that we cut through these efficiently. Now, what you're going to notice with an air-driven handpiece is you get a lot of chatter, a lot of movement from that burr. And that's because the torque isn't great enough to cut efficiently through your ceramics. So with these, I'm going to use the Z95, set at 200,000 RPMs, and I'm going to start with a diamond burr and cut through the ceramics. Once I've cut through the ceramics with a diamond burr, I'm going to switch over to the Emacs, and these are a serrated carbide burr that will quickly cut through the metal. Now, sometimes if it's a really soft metal, say you start cutting and you're like, wow, I'm just blowing through this metal, you'd want to turn your handpiece down just a bit. Maybe drop it to 100,000. But if it's a hard old non-precious alloy, keep it right at 200,000. Otherwise, you'll never get through it. For old gold, like those old gold, 70, 80% gold, go ahead and reduce your handpiece with that Emacs cutter, and you'll do far less damage to the tooth itself. Now, one thing I want you to notice is I got these crowns off, and you don't see retention grooves on the facial. And that's because I was very deliberate in switching from that diamond to the carbide. The other thing I want you to notice is these teeth all appear to lean to one side. The reason they're leaning to one side is because this operator lost their reference. Now, I can tell you, in training over 6,000 undergrad dental students, that this individual is right-handed. The reason I know that in watching 6,000 dental students over 27 years prep a bunch of anterior teeth, what I notice is they got really nice parallel walls. But when I tell them to do like an 80% cut, 80% of the prep and come back, that their preps would be leaning, and they would lean away from them. So as a right-handed practitioner, your tendency, if you don't keep a very, very close watch on this, is you'll lean all your preps to the left. If you are, say, left-handed, you'll lean them to the right. Now, I want you to take a look at this case. This is a case I prepped using an electric handpiece. And what I want you to notice is that I went to the effort of making an incisal reduction putty so that I could gauge the incisal reduction. And this helps me line these preps up along the long axis of my diagnostic wax up. Well, with that said, what I want you to do is notice this one right here. This happens to be number 7. And I want you to look at how 7 is kind of leaning away. Now, this will clue you into what hand I use as a practitioner. See, this one, number 10, is staring me right in the face because I'm a lefty. So that prep is perfectly aligned. But as we travel across the arch, this prep tends to get away from me as a lefty because of its distance from me. So you have to be really careful. Good news is I prep this to about 80%. I can recover that very quickly, and I use this putty to do that. So if you're not in the habit of using a putty when you prep these anterior cases, do that. Now, this is another putty that I like to use, and that's one that's made from the diagnostic wax up, where I actually cut out a window so that I can judge facial reduction. Again, these are prepped with the Z95 set at 200,000. When I get to refining these preps, I'll drop my speed down to about 100,000 to allow me to refine at a lower speed. So I want to talk a little bit about preparation protocols. Now, one thing that my good friend Mike Detola has said after years of working in the industry as a dentist and then overseeing labs is that the average dentist is chronically underprepared for posterior restorations. Now, what he meant by that is they don't get enough occlusal reduction. So I'm going to show you a couple of tools that I think can really help with your preparations. The first is from Contact EZ, and these are nothing more than preparation guides. They're 1, 1.5, and 2 millimeters, and they're designed to sneak in over the marginal ridge and rest in the central fossa. And then you instruct the patient to close. And if they come into contact and their bite isn't closed, you know that you're under reduced. That's one way of checking other than using your eyes. The next way I like to check is with something called a prep check from Common Sense Dental Products. This is a pad, a foam pad that's got a dye on it, and you can get them in 1 millimeter, 1.5, and 2 millimeter thickness. When you have the patient close, you have them simply close in centric, and they will transfer a mark like you see here in this bottom picture to any area of the preparation that is not at the desired thickness. Then you get out your handpiece and a football diamond and buzz those down. Now, I want to briefly mention Emacs. The protocols have changed a bit with Emacs in their occlusal reduction. And it has to do with whether you intend to adhesively cement or use a conventional cement. What Ivoclar has noticed is that there is a higher propensity to fracture using conventional cement. So what they're saying is if you're going to conventionally cement Emacs, you need at least 1.5 millimeters of occlusal reduction compared to one that's adhesively cemented. So with that said, I just generally shoot for that 1.5 millimeters. With zirconia, you could sneak down to say 1.2 millimeters, but in reality, we've all seen zirconia crowns fracture. With zirconia fracturing at 0.5 millimeters, I like to get up to that 1.2 millimeters and strive for 1.5 basically with every restoration. And I do that using that 1923C football diamond set at 200,000 RPMs. And then I check routinely for occlusal reduction. Now, I want to talk a little bit about anterior preparations. Again, generally speaking, I'm going to knock these out using a coarse diamond burr. Then when I get to the phase of refining, I'll drop from 200,000 RPMs down to say 100,000 RPMs and really slow that handpiece down to do my refining motion. Now, one thing that was problematic initially with the initial electric handpieces, and actually still some of them on the market, is because of their overall size and weight, you didn't get a lot of tactile feedback from the handpiece itself. And the reason so many US dentists like their air German handpieces, they were fairly light And if they grip them with light pressure, they would get tactile feedback from the handpiece itself. Well, the beautiful thing about the Z95 is because its weight is so light, you get that same tactile feedback from the handpiece, especially when you drop the speed down for refining. So rough prep at 200,000, drop it down to refine. And I like to use 2 burrs for most of my anterior preparation. I'll get at least 1.5 millimeters of lingual reduction, up to 2 millimeters whenever possible is ideal for our aesthetic restorations. With a zirconia preparation, same concept. I'm going to get that 1.5 to 2 millimeters of occlusal reduction. We want our preps nice and refined. I'll use that modified chamfer using the 1116-8. And again, to prep zirconia preparations, start at 200,000. When you get to, I'm going to refine mode, drop your speeds down. With your bridges, this happens to be a bridge preparation, shoot for that 1.5 to 2 millimeters of occlusal reduction. And keep in mind that you want that connector space to be a 12 square millimeter. With these, if I'm really going for pure refinement and I want crystal smooth margins, I'll drop from 100,000 to say 50,000 to do some real fine margin refinement. And that's using the same burr, same handpiece, just go to your control pad and drop those numbers down. Now, I want to talk briefly about veneers, and there's a couple of questions that I always ask myself when I'm doing a veneer prep. Will the teeth be lengthened or shortened? If the answer is yes, I've got to wrap the incisal edge. Will any incisal embrasures be repositioned? If the answer is yes, I must break the proximal contact in that area. Are there any black triangles to close? If the answer is yes, I'll consider subgingival margins in the interproximal area of about 0.5 to 1 millimeter to help the lab create emergence profiles that are pleasing. Now, when you look at a case like this, where we're prepping 2 veneers and you have 2 distinctly different teeth, you need to make sure that your laboratory has their shade guide and they know the color of the preps. So it's essential that you take photos, not only of your shade tab, but actually of the tooth color and a stump shade. When I'm refining these, I'll start at 200,000 RPMs with my coarse diamond. Then I'll turn the handpiece down. You can see here, I've got an inner guard here, which has been badly damaged by my burr, which is okay, but the adjacent tooth hasn't. So I come in here and I can really refine these margins now at 50,000 RPMs and create beautifully smooth margins and get results. Now, this happens to be various preparations that have all been cut at 200,000 RPMs with the Z95 and then dropped to 100,000 to 50,000 RPMs for refinement. And really, as you learn to work with electrics, you're going to figure out where your refinement speed is most comfortable. With general crown and bridge, I'm at 100,000. With veneers and onlays, I'll drop that down to 50,000. Now, I want to show you a next patient here that had this large diastema between her front teeth. And I'm going to just show you very quickly what we do. Now, with this case, her desire was to close the space between her front teeth. The problem is that's a 6 millimeter space. If I just close those space without doing anything else, we'd have issues. Now, when I look at this, I've got obviously a large triangle, not even a triangle, we'll call this one a square that we need to close. And I want to move this embrasure mesial. So when I prep these for veneers, I have to break contact here, favoring the central, and I must prep subgingival here to create an emergence profile. And I've got to wrap the incisal edge because we're in a lengthened teeth. So this gets to be a fairly aggressive preparation. With that said, when we do those things, and she was okay with a small gap, we can create really nice aesthetic results. So there she is before. there she is after with that small diastema, and she was really pleased with the result. And we haven't given her artificially wide teeth. And those are using those veneer principles that are so, so important. As a last case I want to show you, this is a case where I've got to cut off 2 existing PFMs. I've got a very dark tooth underneath, tooth number 9. This patient desired for an enhanced aesthetic result. The problem is that dark tooth, that endo tooth. So I've got to manage that very precisely. I'll cut off these PFMs or zirconia crowns with the Z95 set at 200,000 RPMs using my diamond burr first, then go to the max 2. I'll take my shades ahead of time so that my lab can do the best they can. What would you do? Hopefully you prep these conservatively. If you notice, we've got the old crown off and we've got this very dark tooth. Now she wanted to get these as aesthetic as possible. So what we chose to do, and this is something that's very challenging, is a veneer to be conservative next to this crown. That's technically the hardest thing you'll do. To match the opacities here is virtually impossible, especially when you have this dark root. But to hide this, what I do is I bump up the ceramics here, and I get those ceramics just a bit brighter. Now, this is all refined using that 50,000 RPM. When we get to a case like this, there are the results before cementation, just trying things in. I'm going to de-emphasize the brightness here just a bit with my cement selection. And she goes from there with 4 restorations to there. And from a conversational distance, I just think they're really beautiful teeth. Given where we started and where we end up, she was thrilled with the results. Now this case is now 9 years old, all done with electric handpieces, all done using the protocols we've discussed tonight. So with that said, I want to thank all of you for joining me for this brief presentation. I hope I was able to shed a little light on some of your concerns with electrics. And at this point, we'll open it to any Q&A. If we've got some questions, I will do my best to answer them. If I don't know the answer, I'm not going to BS my way through. I'm going to tell you I don't know the answer, and I'll apologize for that. So with that said, we'll open it to Q&A. I think we'll, Corinne's going to read us a few questions if we have any.
Yeah, we have a few so far. Great
Oh,
presentation. So we definitely have some questions ready for you.
Okay, let's do it.
All right. So the first one is from Isabel, and she asked, just to clarify, for margin refinement, you can use a coarse diamond at 50,000 RPM?
Absolutely. Now, some people like to switch to a fine diamond, and that's okay. But you can use that coarse diamond at that setting at 50,000 RPMs, and you'll get really smooth margins. One thing with a fine diamond, and we have to keep this in mind, is one drawback to a fine diamond is it creates a very smooth prep, which sounds like a great thing. However, if you're dealing with zirconia and trying to get that to stay on a tooth, having a super smooth surface is kind of counterproductive. So I like a coarse diamond or a medium diamond if you like. Now, if you want to just refine your margin with a fine diamond, that's totally acceptable. But I'll do a coarse diamond 99% of the time. And I get really smooth, crystal clear margins just by decreasing the handpiece speed.
All right, awesome. Thank you. We have a question from Mina who says, since I started to use electric, I find that the burrs get clogged fairly quickly in the area prepping the cervical part of the tooth. Do you have any suggestions?
Yeah, so one thing, first of all, is to consider adjusting your air-water ratio. Turn down the air a bit and see if you can't get just water going. So use that little adjustment if you're using the NSK burr. And then the other thing is make sure if you're using a sterilizable burr, is make sure your assistants are really cleaning the burrs before they autoclave them. Because what will happen is they just send the burrs through an autoclave with debris on them. That will get baked into the surface, and you'll find that the cutting efficiency goes down. And that's one of the reasons I switched to single-use diamonds.
Okay, great. And then we also have a few questions from Adam. So the first of his question is, what is the best RPM slash burr to remove a zirconia crown?
Got it. Okay. So I treat that similar to a PFM. The only difference is I don't switch to a crosscut burr. So to remove a zirconia crown, and I apologize for not mentioning that earlier, I use a coarse diamond burr. Now, some say it cuts more efficiently with a fine diamond. I did mention that. I don't find that to be the case. So I cut it with a coarse diamond burr, and I'll section all the way from the buckle to the lingual, and get that in two pieces with a coarse diamond set at 200,000 RPMs. Keep the RPMs quite high, and you'll get that off with no problem.
All right, great. I think we had a few questions on that, so that was awesome.
Right.
And Adam also asks, what's the best setup for installing a high and low speed? He currently has an electric handpiece, and he said he wastes a lot of time just popping the handpiece off and on. So do you have any suggestions?
Yeah. So in a perfect world, Adam, what you would actually do is have two motors, and two separate controllers right there, and you'd set one permanently as your low speed, one permanently as your high speed. Now that's in a perfect world. Otherwise, you're gonna have to spend seconds popping these on and off. So it's really nice when you have the luxury of having two of these chairside. In one of my ops I do, and one of them I don't. So it's the only way around it.
Okay, thank you.
Yeah.
Our next question reads, if you can control the RPMs on the hand pieces, why is it necessary or why do you need a slow speed?
Well, okay, so it has to do with the gear ratios, and really, it's the low speeds are set at a much lower RPMs, and the high speed are set at much higher RPMs. So you need that low speed to be able to really precisely dial those down to say 1500 or 4000 RPMs, which you can't really do with a high speed. It's not going to work in the same way. So you do need that control. With an air driven, all you're doing is lifting your foot off. The problem is you don't know how fast you're moving. You know that when you push on the rheostat, you're probably getting up to 400,000 RPMs, but when you back off, you really have no way of knowing. And the beautiful thing about electrics is that we can set them precisely at the RPMs we want, whether it be using a high speed or low speed. Yeah, thanks for the question.
Awesome. And then Donald says, great seminar. Can you
Thanks,
speak?
Donald.
Can you speak to the electric handpiece lifestyle, maintenance, and prevention of thermal injury?
Yeah, okay. So the thermal injury really comes probably more on the surgical side, which I don't do a lot of. So I really can't answer that, but I can talk about upkeep and life expectancy. And that probably varies greatly with how your team is maintaining the instruments, and really how old your burrs are. So what I've noticed in our practice, as soon as we went to the use of more single-use burrs, our repairs and exchanges with work went down dramatically. I used to be sending out a handpiece a month to get a turbine redone. And I really think that was because I would sit there and lean on an air-driven turbine with old burrs, and I destroyed the turbines. But with a high torque of an electric coupled with disposable burrs, or fresh burrs that you haven't reused 100 times, you're going to find your repair rate goes down significantly with the electrics. So while and I mentioned their upfront cost might be slightly higher, your $500, $300 repairs are going to go away. In fact, knock on wood right here on my desk, I have not had to send an electric handpiece back yet for repair.
All right, I'm knocking on glass right now. I don't have wood.
Oh gosh.
Piggybacking off of that, Catherine asks, how many times a week should I manually lubricate an electric handpiece if I'm not using an automated maintenance machine?
I wish I had the answer to that, and I don't. It's going to be largely based on how frequently you're using it on a daily basis. So that's a good question for your local handpiece rep. I wish I knew the answer for you, but I don't. I'm sorry.
It also might, I was thinking, vary from handpiece to handpiece as well.
Oh, absolutely. Yeah, absolutely. It really gets down to, the number of times a day that handpiece is used and for how long. So for instance, if I sit down and I'm prepping on teeth for 2 hours, that's different than me prepping sealants. So it's going to be varied. I think more is probably better than less, but a good question for your local Schein rep. They can help you out with that, or your NSK rep.
Awesome. Thank you. And our last question is from Drew, who asks, what burr do you use to trim class 5?
Okay, so great question. Drew, what I like to use is either a fine F or EF 9mm burr. You can get a shorter one, 4mm burr, but I'll use those carbide burrs, fine or extra fine. Now, if you're using an extra fine, it's going to take you a little longer to cut the margins away. Don't get anything coarser than a fine burr. So, and it's going to just be a little less flutes as we get up to a fine burr versus an EF extra fine. But I really live between that fine and extra fine burr, and you'll cut very efficiently with those type of burrs. Try and stay away from a diamond down on the cervical area because it will actually scratch your composite and make it harder to polish. So Drew, thanks for that question.
Awesome. Well, that wraps up our Q&A this evening.
Excellent. Well, I have a few slides that Schein has asked me to go through real quickly. You can visit webinars at henryschein.com, and henryscheindental.com. Webinars is another way to get there. I want to thank Schein and NSK for asking me to present on a subject that, it's not glamorous, but hey, it's our tool. It's our daily tool. They're very important to us. So thank you both, NSK and Schein, for inviting me to speak.
Of course. And thank you so much, Dr. Geissberger, for the great presentation this evening. And again, thank you to NSK for sponsoring the webinar. If anyone does have any outstanding questions, you can always email us at webinars@henryschein.com. And to view and register for upcoming webinars, go to henryscheindental.com/webinar. And as a thank you for attending, everyone will receive the recording via email in the next week. So thank you all for joining us, and we look forward to seeing you on future webinars. Thanks again, Doctor.
Bye now. Thank you.